Hello, ladies and gentlemen. Thank you very much for joining me today on this live webinar. It's a very valuable class on dietary and herbal treatments for joint pain. So we have many types of inflammatory conditions. You can have intestinal inflammation, you can have nerve pain, sciatica, and other type of neuropathy pain. You can have muscle pain, like in fibromyalgia, if the connecting tissue can be inflamed. But we're talking today about joint pain, first of all. So we're going to cover first the causes of inflammation, which is really important to understand the causes. I mean, most people have caused their pain. Weren't born with inflammation. So, we did have to some degree have to take responsibility for what we did. And we're going to talk about those causes because those causes have to be removed. I mean, you can't say, oh, just take this for your pain. What caused it? What have this person been doing for the last 20 years that caused this pain? And what are they probably still doing that's contributing to this inflammation and pain? So that's first. Then we're going to talk about types of pain, because as per Ayurveda, nobody has exactly the same type of pain. So if you want to treat pain, you have to be able to classify it. And we're just going to break it down here into three simple categories: vata, pitta, and kapha pain, even though there are many other classifications. And then we'll talk, of course, about the anti-inflammatory diet, because that always should be the first line of treatment is change the diet to balance the dosha, remove the inflammation and the causes of the inflammation. And third, we'll cover, of course, herbal remedies, which are really, the most important thing here for anybody who is trying to, reduce their pain down. So let's start with because herbal treatments, of course, give us these fast results and give us and address the removal of the cause. So let's be clear here. I mean, there are analgesic herbs, or where you're just removing the pain. And then there's herbs and treatments that are removing the causes of the pain. So, I mean, we can take a look here at a few testimonials, and we can see here on my website, I have a whole category under testimonials. I have almost 400 testimonials, so they're classified by health condition. So we can go down the list: or infections, kidney, liver, memory, menopause, pain. And then we can read here and we can see some of these testimonials. I woke up this morning with no pain. I've never felt better. Khabir has saved my life. Well, at least I reduced the pain and inflammation down. She also mood improved, lost 51 pounds. Of course, this is an IBS, inflammatory bowel syndrome, also another type of inflammatory condition. I'm healthier now and have been so for years. No arthritic pain. So that's what we're talking about today: arthritic joint pain. And I would say that the herbs have most credit here. No aches and pains. He understands the different types of pain and a nice routine. Okay, IBS, stomach inflammation, headache, pain, abdominal pain, cut down on the pain medications, migraine gone, joint pain. Well, there's a nice one there. There is no question that the herbal massage oil is not only very relaxing, it has noticeably reduced my joint pain. I look forward to my drive to Ojai. This is a client. Swelling gone. You're a magician. The inflammation has been greatly reduced. Once again, it is the herbal remedies that are removing the causes. And here I have less pain in the body. I've had no fibro pain for 4 days now. So this person was diagnosed with fibromyalgia and now has no more inflammation. So you can see the results are outstanding and quite impressive. And many people, of course, elderly people, believe that, aging, you're going to always have pain. Well, that's a false belief. I have clients, in their 70s and their 80s, even early 90s, who I've treated successfully and now no longer have arthritis. Again, If the cause is identified properly, the type is identified properly, and you're treated properly with herbal remedies, the pain goes away and doesn't come back unless you, of course, repeat these causes. So let's start with the causes. And of course, fibromyalgia is more of a muscular pain, and we're really focused today on joint pain because there is variations in the treatment and variations in the herbs when you're treating joints and compared to muscles. So, but the cause is still very similar. And the cause, of course, in Ayurvedic terminology is ama, toxins. Now, where are we getting these toxins from? These are just not toxins that we breathe in from the car pollution or air pollution. But processed food is full of toxins. Food that you buy that's not organic, full of chemicals, pesticides, toxins accumulating in your liver, circulating through your bloodstream, and eventually getting lodged in your joints. That's a very important point. This is the Ayurveda perspective on the cause of joint pain. There's also doshic imbalances. There's ama, toxins. But why do the joints feel pain? It's because toxins, and there's many types of toxins, get lodged in the joints. So the herbs are cleaning out the toxins in the joints. That's why people can take my herbs for 3 to 4 months. The pain's gone and it doesn't come back. It's not like a painkiller where you just take it away for the day. When you start, the pain slowly gets better. Maybe 1 week, you hardly notice a difference, but a month, you notice, wow, it's a big difference. After 3 months, it's almost gone. After 4 months, it's gone. That's it. You don't need to keep taking the herbs forever. So this is what people don't understand. Sometimes people take these herbs and they think, oh my God, that my pain is so much better in just a couple weeks. Well, I have to take these forever. No, because the herbs are addressing the causes. They're removing the toxins from your tissue, your joints, your muscles, your nerves, in this case, the joints. So they're getting in the system from the chemicals, the pollution, the bad food, the processed food, and your poor digestion. When you don't digest well, you are creating ama, or toxins. It's like the car. If the engine's not burning well, it creates some soot and, it smokes. Like if the engine's not, tuned up correctly, it has smoke coming out. Well, that smoke is a toxin. So when your engine, your digestive system is not running properly, which, you'll get plenty of signs: gas, bloating, constipation, acid reflux, abdominal pain. Any of these signs, basically your digestive system's not operating properly. And not only could you have nutritional deficiencies and other deficiencies because you're not absorbing the nutrients, you're actually creating more toxins. So when your digestion is poor, your agni, your jatra agni, your digestive fire is poor, and you are creating toxins every day, even eating organic food. And you're probably creating nutritional deficiencies because you're not getting the nutrients and you're creating more toxins. So this takes decades of this poor digestion, plus, of course, all of our bad habits and exposure to chemicals, toxins, and food that's not organic. That's why you want to eat organic food. Those people who eat organic food, like myself at the age of 60, and no joint pain, because all of those years of having pretty good food, and I can't say I did it all the time, but enough that my body, it didn't accumulate the toxins. That's the secret. We're all absorbing toxins every day, even when we have fairly good digestion. There's always some ama or toxin created, but can the body eliminate it fast enough to not allow it to accumulate? So it's the accumulation of the toxins first, and then it's the spreading of the toxins. So you have to have the toxins accumulate to the point that it overwhelms the body, the liver, the eliminating systems, the sweat, the liver, even the lungs. Every time we exhale, we're exhaling toxins, carbon monoxide. Every time we sweat, we're getting rid of toxins. Every time we defecate and go to the restroom, we're getting rid of toxins. When we urinate, we're getting rid of toxins. So every day the body's getting rid of toxins. But if you're taking in so many and you're not, these eliminating channels are not eliminating properly, then you're going to accumulate toxins at a fast rate, overwhelm the system, and eventually they're going to spread through your through your circulatory system, through the body, and then they're going to get in your muscles or your joints, your nerves, and then you're going to have the pain. So that would mean if you're constipated, which maybe just be not going every day for 20 years, you are definitely creating a lot of toxins, and you will have a type of arthritis. So the different types now, which we're going to cover, are based on the type of toxin to some degree and your Ayurvedic body type. So the first type of joint pain is dry, cracking joints, or degenerative, we could osteoarthritis, we could say. So this, usually the precursor to this, there's always signs and symptoms of every condition way before it comes, even decades before you get the pain, there's signs and symptoms. For this type, the sign that the pain is going to come is the constipation. And because that's you're creating it. You're not been going to bowel movements every day. So if you're already 40 and you've been having 40 years of constipation, this is a type of toxin that's going to create from this. You get an autotoxicity. You're not eliminating fast enough. And then other sign is cracking joints, cracking. Fingers go, I got a crack. Cracking, but easy cracking. That's lack of fat, lack of lubrication. This type of person usually is dry, light, and thin. And obviously, if they're on a weight loss plan or a low-fat diet, it's going to make it worse because you're going to have less cartilage, less lubrication, more cracking. And, so you get the cracking first, the constipation. These are all you got to put another 10 years on top of that. You start to have pain. Another 20 years, a doctor may be able to identify it and call it arthritis and give you a painkiller. But what you need to do is, of course, improve the digestion, improve the constipation, eliminate the foods that are constipating you, obviously, and your eating habits, which are constipating you. These are other subjects. And then, of course, take the appropriate herbs that match that type of joint pain, which we're going to cover. But the second type of joint pain, pitta type, is usually hot and burning and inflamed. It's like, oh, it gets hot, it's inflamed. Like I can touch a person and they say, oh, my neck is hurting. I could put my hand there and I feel it's clearly hot, it's inflamed. And I ask them, do the joints feel even burning at times? Yeah, they feel burning at times. So the first type, the dry cracking, these people, they actually feel better when they're not moving, because when they move, those joints are moving and it's creating more pain. And they feel better when they're in hot bath or hot tub or hot weather. So they could take a hot salt bath. And the first type, the vata type, can feel better. But the second type, this pitta type, where you already feel this burning, hot, sharp pain. If you take a hot bath, it's going to make it worse. You might as well just go jump in the ocean and swim around in some cold water. And of course, different foods are necessary for different types. So the third type is a kapha type. And this type of pain is dull, constant pain. And there's a lot of stiffness, like they're stiff and they feel really stiff in the morning, hard to get going. The joints are painful when they wake up. So their joints feel worse when they're not active. When they get out, go to the gym, get moving, get walking, then it starts to feel better. And usually this person's overweight, so we get joint pain a lot on the knees, and because of having to carry the weight, and the hips, lower back. And if they're constipated as well, then they're creating the toxins. And usually this type of person has poor circulation, varicose veins, cellulite. So, you're not getting the blood circulating very well. They're stiff, stagnant, a type of stagnant system. It's not moving. And this is allowing these toxins to accumulate in their joints. And of course, other causes are including autoimmune conditions, but we're not going to cover that at this time. So we're going to cover these three types of joint pain. This dry, cracking, kind of like an osteoarthritis, degenerative, where the tissue is in the cartilage is deteriorating, and then there's this type of pain that hurts when you active, or particularly if you're running or moving or walking on a hard surface. And that's a Vata type. And the second type is hot, inflamed, burning type that feels worse if you get in a hot tub, feels better if you go take a cold shower. And the third type is the stiff, congestive type of Kapha type. Okay, so we're going to talk about herbs for these three sections, but first I want to cover the anti-inflammatory diet. Now you have to remember this diet is not for everybody because we really have to consider at least three factors when treating somebody with a diet. For one, we're going to remove the anti-inflammatory foods, which I'm going to cover, but two, we have to balance the dosha. I mean, if we know we have Vata pain or Pitta pain or Kapha pain, then, we have to balance the Vata, Pitta, or Kapha, or the pain's not going to go away. And if we know that Ama is the cause, then we have to remove the Ama. And the source of the Ama, which could be the poor digestion, the poor eating habits, the constipation, even the acidity. So these have to be treated. So the diet could vary. And if a person is very overweight and putting a lot of weight on their knees and creating pain, then obviously they're going to have to lose some weight to get this pain down. So don't think that you can just take these foods out and your pain's going to go away. These foods will just make it worse, basically. So we have to remove them. So the first category is nightshades. And hopefully many people have heard of that. Amazingly, a few doctors even told their patients to remove these, or at least tomatoes. So that's progress. I mean, Ayurveda has known about this for thousands of years. And it's very encouraging now that in the year 2022, a few medical doctors have picked up on this ancient wisdom. And I think that's because research has come out to prove that these nightshades, particularly tomatoes, particularly canned tomatoes, particularly tomato sauce, is very inflammatory. So they have to go. And that includes, of course, other nightshades, including eggplant, bell pepper, the white potato, not the yam or the sweet potato. And then, of course, there's other little nightshades. Paprika is a nightshade used in the South. And goji berries, which was once, classified as a superfood. Of course, everything was called a superfood at one time. They're also nightshades. So other things those need to be taken out in all three cases. And also sugar. We're not talking organic cane sugar. People mix fruit up with sugar. Oh, I can't have any sugar, so I'm not eating any fruit. No, fruit is fine. Particularly if you're constipated, you need a fruit for its laxative effects to keep your bowels moving. If you're dry, you often need juicy fruit to just stay hydrated. So fruit is actually very beneficial. Fruit is not going to create any more inflammation. We're talking about processed white sugar. We're talking about croissants, candy bars, soda pops, inflammatory and nutritionally depleting, and a lot of other health harm that can come from having sugary processed foods. And then, of course, all foods that's not organic, a person should get on a pretty much organic diet, stop doing processed foods, canned foods, and such. And also coffee. Now, many people love coffee. You could go find something good and bad about probably anything now online, which is what makes it so confusing. And some people are saying coffee is the best thing ever. Of course, we know why we're all hooked on coffee, at least at one point in our lives, because we're trying to push through and get more done than we're actually capable of doing. So we do the coffee. But it is inflammatory, and even your decaf is still inflammatory. So it's not the caffeine, but it's coffee bean is inflammatory. But green tea is not. So it doesn't mean that coffee is. So generally, we have to take out the coffee. And and we can replace it with green tea if there's no palpitations, anxiety, or insomnia, in which case, no green tea too. Then next, and I know this is going to be sad for some of you, but it is inflammatory, chocolate, or we could say the cacao bean. I know there's been foolish, unknowledgeable nutritionists who have advocated chocolate for everything and a cure for everything. It is stimulating. It is an aphrodisiac, and there's no doubt there's some benefits to cacao, but mostly we have it with sugar. and it does create inflammation. So we have to eliminate those and stop eating packaged and prepared foods. After that, the diet has to be adjusted for the individual, whether they're Vata, Pitta, Kapha, and that is a whole nother subject. I think I have videos on that, like anti-inflammatory diet per dosha or per body type. So those foods are just the things you just eliminate. Then you still have to put the person on a Vata balancing diet. If they're constipated and dry and their joints are cracking, then obviously you're going to be giving more fat, more oil, and they're depleted. The cartilage is low. You're going to give them more protein, more animal protein. And no, dairy is not inflammatory. Maybe what we've done to it and the pesticides and the chemicals are, but dairy in itself is not inflammatory. And that Vata type person needs butter, cheese, and fish and will not do well even on beans once she has a degenerative bone condition like osteoarthritis. So, and then of course the Pitta person who's hot and burning pain, he can't have chili peppers, hot sauce, not even ginger. I mean, even too much turmeric is, turmeric is related to the ginger. And if a person's already hot and burning and you give them a bunch of turmeric, it's just going to become more hot and burning. So for the that type of person, this Pitta type person, they should have sweeter foods, sweet fruits, not sour. Sour creates more heat. Sweet fruits, blueberries, strawberries, melons, and no hot, spicy, more bland, coriander, fennel, and no red meat. So you have to have a Pitta pacifying diet as well, because we know that Pitta is behind this hot burning pain. So we have to get this burning heat down, and chili peppers are gone. And hot salsa makes it worse. And liquor, of course, makes it worse. So no liquor, no hot salsa, no hot spices. And 9 out of 10 people with this type of Pitta inflammatory pain are having hot spices and salsa and alcohol every day. So they created it. And acid reflux. If you have acid reflux, you're creating this too. And I also find that the Vata types who are thin, dry, light with cracking joints, they've been on a weight loss plan their whole life, not eating much fat and been constipated. So they created the problem. The third type is the Kapha type. And of course, for them, they have heavy stiffness. They should have no meat at all, almost no animal protein at all. I have to have only 2 meals a day. They have to lose weight and should be eating more beans and 0 animal protein at all. So just because you watch the webinar doesn't mean you really know what foods you should be eating. You can eliminate these foods, but then you still have to have a Vata or Pitta or Kapha balancing diet. And of course, if you have an autoimmune condition, then this is another case. There's all different foods that have to be eliminated when you have autoimmune condition, like mushrooms and honey, things that people didn't even think about. And I could tell you, everybody who's got an autoimmune condition I met, at least 60, 70% are having mushrooms every day, because it's another fad. People think it's good for everything. So they start taking these, and they, of course, overstimulate your immune system and make your immune system overreact, and your rheumatoid arthritis or your psoriasis all gets worse. So different causes require different diets and different treatments. That's a very important point. You have to know the cause of your inflammation and pain. You can't be guessing and just go online and take some CBD oil and think it's going to go away. No, CBD oil is not going to remove the causes. You may take away pain for the night, but it has no therapeutic benefit at all. 0. It may make you more relaxed, but it may help with the pain, but is not a treatment. No more than taking an aspirin. An aspirin is not a treatment for pain. It just, reduced it down for the day. We're talking removing the pain once and for all, like my testimonial said, like all Ayurveda doctors are doing successfully. So let's look at the herbs next. And of course, the most common herb used in Ayurveda for joint pain is guggulu, which is a black tarry resin. There's the guggulu powder, organic. It's like black tar. But, you know, it's not taken by itself. It's usually mixed in formulas. And of course, remember, we have at least 3 different types. So if you're a Vata type, you're going to get this formula here to some degree. Yogaraj Guggulu. That Yogaraj Guggulu. Yogaraj Guggulu. It's a Guggulu, but you don't see it's not, probably only 10-20% Guggulu. The rest is all herbs, and that is made for this person with a dry, cracking joints. And then if you are Kapha, we give you Kanchnar Guggulu. Kanchnar Guggulu is for stiffness, heaviness, overweight, and also shrinks tumors. So it's a shrinker. It's for the heavy, overweight, stiff person. Of course, there's other herbs we put with it. And then if you're Pitta and you're hot and burning, and Guggulu tends to be, then you have to do a cooling Guggulu because we can't make you more hot. And that would be, you know, Kaishor Guggulu. That's for Pitta type. So that's the 3 types. Of course, we've formulated these in products, and we do add some other herbs to them that are analgesic. Analgesic means it just takes away the pain. And the Guggulus are what's famous for cleaning out the toxins out of the joints. Okay, that's why you have to use the Guggulus. Guggulu is a resin. And of course, Guggulu is a type of resin, and we could call the king of resins. And what is the queen of resins? That's it right there, frankincense. This is frankincense gum, by the way, from Oman, or I went to Salalah in southern Oman and went to the only frankincense market in the world, and I brought a few kilos, and that was 5 years ago, and I still have some left because this is the same frankincense, apparently, from what they said in Salalah, that was given to Jesus by the 3 wise men. And we call in Ayurveda a boswellia, and that's shilaki powder. Shilaki is the extract of frankincense. Now, we also have frankincense. See here, boswellia. Boswellia is frankincense powder, gum, the queen of resin. See, it says gum resin powder. Of course, organic. We only get the best. But shilaki is even better. It's the extract of boswellia. It's very expensive. I mean, this is a pound of this stuff. It's not cheap. And I could tell you that is 10 times more powerful than turmeric. In fact, Ayurveda doesn't use turmeric for pain. I know that Westerners think that it's a cure-all for pain, but it's not used in Ayurveda. It's mostly used for as an antihistamine in allergies. Like my allergy formula uses some turmeric. My respiratory allergy formula uses some turmeric. Skin allergy uses some turmeric. My acne formula uses. That's it. That's the only few formulas that are using turmeric. Of course, we have many seasonings and spices, and they have turmeric, but we don't use it for pain. Now, of course, nowadays you can get curcumin, which is much better. And I don't use a lot of extracts, but you can get curcumin, which is turmeric extract, 95% pure. Everybody says they have the best, but you know, it's not difficult to get curcumin these days. It used to be very expensive. The price has really gone down. Now back to other, and those are anti-inflammatories. So we're talking curcumin, boswellia, shilaki. These are the anti-inflammatories. Very quick, dropping down the pain for a short time, bringing down inflammation. Not everybody needs an anti-inflammatory, by the way. You may just need the guggulu, the Kaishor Guggulu, Yogaraj Guggulu, and Kanchnar Guggulu. There's Simnahanda Guggulu. There's many Guggulus. You have to pick the right Guggulu for the person because that's the key treatment. The anti-inflammatories are usually secondary in the treatment if there's inflammation. Sometimes a person's inflammation drops in the first month, but they have to keep going with the Guggulu. So we'll show you some products in a minute. But there are, if your person's in pain, we want to put some analgesic herbs in the formula as well. Nirgundi is one of the most commonly used analgesic herbs. And also rasna. Rasna, also just analgesic herb. So if your pain's not too bad, you're just feeling it's a little bad, but you're not taking painkillers. Then I can make you a formula. I won't even put in the analgesic herbs. And if you're not flaring up where it's really bad, I won't even give you the anti-inflammatories. I need my guggulu product to get in there and clean out the toxins. But let's take a look here at a few products. There is our anti-inflammatory, and there is the boswellia extract I just mentioned. And then we have the curcumin extract too, and a little amlaki and a little pipili, and there's a little turmeric in there to kind of a filler. So this is a very, very powerful anti-inflammatory. I mean, 1 or 2 spoons and your pain drops for about 4 or 5 hours. And it's working both for intestinal inflammation. It's reducing systemic inflammation all over the whole body quickly. Very, very effective. And the only product we have with extracts, both frankincense extract and the curcumin, the turmeric extract. Very, very effective. But again, it's not a cure. The frankincense is a resin and can help remove the toxins, but not when it's an extract, because you've lost certain qualities of it. So extract has a quick anti-inflammatory effect, but it doesn't have a deep penetrating effect like the guggulus. So sometimes we combine it. Here's the formula we use for the vata type pain. Now that we've gone through there's its first ingredients, Yogaraj guggulu. Simple. It's probably half the formula. And then nirgundi. Nirgundi is the analgesic herb in there. And then tagar, which is actually a sedative. You know, we also use it in sleeping formulas. There's probably just 5% in there, but it's also got analgesic qualities, and it settles the nerve system. So this formula works very good for nerve pain, joint pain, and arthritis. And you can take a couple times a day, half teaspoon to 1 teaspoon in a little hot water after meals. By the time you finish 1 jar, you can notice maybe 20% better. So when the client does the follow-up, I don't ask them, is your pain gone? I say, how much better is it? And they'll say, 20, 30% better. So if they say 25% better, then I do a little math and I think 3 more jars, they should be done. It's volume. I mean, if they want to take the herb slowly, then okay, they can wait 6 months to get rid of their pain. If they want to take it every day, 3 times a day, they could have their pain gone in 2 months. It's up to them. But at the end of the day, they're going to probably have to finish 4, 5 jars. And I've had people come in on walkers, wheelchairs. Second appointment, they're off the walker. 2 appointments, they're out of the wheelchair. 3 or 4 appointments, they're already giving me testimonials. 5, 6, jars later, they have absolutely 0 pain at all. But you got to keep going, and you got to keep taking the herbs. So here's the next one. This is for pitta. This is for the person who's got the hot burning pain. See, for chronic joint and muscle pain. Didn't say nerves on this one. You notice there's Kaishar guggulu, the first one. Musta, which is another anti-inflammatory cooling herb. And there's the nirgundi again for analgesic, and a little amlaki as well. So this is for that hot burning pain for that person. I mean, we got other pain formulas too. We're just simplifying it here, really. And this is for this heavy, stiff, dull pain of a person who's more than likely overweight, swelling, stiffness. See, swelling and stiffness and joint pain. Didn't mention nerves. And here, actually, I use Punarava guggulu. I actually combined 2, Kanchnar, which I showed you, and Punarava, because Punarava is the best herb for swelling, and it's very good for weight loss. So actually, I'm combining 2 guggulus in here, Punarava guggulu and Kanchnar guggulu. There's rasna, which is very good pain reliever. It's just hot. And nirgundi, so you got 2 analgesic herbs. Musta, also analgesic herb. Little ginger, little pepper to help with the circulation and the digestion. So these formulas, they're very complex, we could say, because they're helping with digestion, they're helping reducing pain down, and they're actually reducing the causes of your pain. Now, generally, I don't use any topical substances in the beginning until, say, we have the pain just isolated to one spot. So people come back after 3 or 4 jars, couple appointments, and they say, yeah, my pain's all gone but my hip. And then I say, what happened in your hip? Well, I had hip surgery. So see, that pain isn't going to go away easy because the cause was a surgery. So, or sometimes people say, yeah, I broke my ankle when I was young and it never got better. But when their whole body was in pain, they didn't feel the ankle. But now that all the pain's gone, now they feel their hip, their ankle, or there's one spot left. So once you're down to one spot, then I'll give you anti-inflammatory oil. Of course, in Ayurveda, we know what this is, mahanarana oil. But there we go. See, and that's a bunch of herbs. Dashamula. Dashamula is also anti-inflammatory. Shatavari is cooling. Camphor, ashwagandha to some degree for the right person is anti-inflammatory. Punarava, Vidanga, Bhuma Malaki, a lot of great herbs in here. Guducci, of course, which is really, we didn't even talk about, probably the king of anti-inflammatories is guducci. And so I have other formulas with guducci that I could add to it. I mean, I can change these formulas around. But sometimes we give out a little combination, like for fibromyalgia, we give out this one here to get the inflammation down, and then we put this one on top. And after the inflammation's down, but there's still pain, then we can remove the anti-inflammatory. Or sometimes the bones are cracking in the beginning, we may give, and there's pain, we may give these two in the beginning. So, and then for kapha, we could give even some liver herbs. So you're never going to get just one formula because you probably have digestive problems as well, maybe elimination problems. Kaphas can have sluggish bowels, vatas can have dry, hard stools, and pittas can have loose stools. So that has to be taken care of in all three cases. And kapha could have no appetite and not hungry all day. Pitta could be overly hungry and getting acid reflux, and vata could be getting a lot of gas and bloating. So this digestion has to be resolved as well. You can't just ignore the digestion and say, oh, I'm just going to take some herbs and my pain's going to go away and leave out tomatoes. No, because one, unless somebody picks the herbs for you, you may not even be picking the right ones. And two, there's more than just leaving out tomatoes because you have to balance the doshic cause that's underneath. And yes, I did say that not being hungry is a digestive problem. That's right. If you're not hungry till 2, 3 o'clock, you have a poor digestion. If you can't eat a piece of bread, you have a poor digestion. If you can't eat butter and cheese, you have a poor digestion. So we always like to blame the bread. Bread is bad. Bread is the cause. And this is a very slippery slope because you're not fixing the causes. You're just like eliminating. And you're not really improving the cause, which is your digestion. And what's the cause behind your digestion? Possibly your eating habits, snacking, eating at night, mixing fruit with the meals. I have many, many videos on eating habits, digestion, and diets per body type. So that has to be covered as well. That's why it takes me an hour and a half in the first appointment, because I have to give out a new diet. I have to take care of the digestion. I have to take care of the elimination, and I have to give the right herbs for the pain and make sure that they are correct. And sometimes I have to formulate them myself. And then when the people come back in 1 or 2 months, they may need a different formula because now the pain's not as bad. I don't need the anti-G6. Maybe it's not even getting inflamed anymore. It's just still painful. It's just better. So I can change the formula. I may change the formula 3 times before the person is done. So even I give you the right formula in the beginning, it doesn't mean you're going to have to take the same formula right to the end because you're changing. Same with irritable bowel or any type of inflammatory colon condition where you have loose stools and diarrhea. You know, once the loose stools and diarrhea go away, you still got the inflammatory colon. It's just not as bad, but the herbs have to completely change now because initially the herbs were helping to astringent herbs, cooling herbs that were restricting and tightening the tissue to stop the loose stools and the diarrhea and the loss of water. But once you become constipated, you have to stop those herbs. And now we have to take other herbs to continue the treatment of your IBS because you're but they have to be different now because you're not having the loose stools. You're getting better. It's the same here. So this is why people need to follow up because, okay, even I give you the right herbs and you're happy and your pain's down 50%, it doesn't mean in the follow-up, I'm going to give you the same herbs a second time. And then, of course, we have the seasons affecting us as well. It could get cold where you are in the north. It could get hot in the south. That may affect even the herbs that I give you. And, of course, on the second or third appointment, or second appointment, your digestion should be better. Your elimination should be better. So maybe it's so good now after you change your eating habits, change your diet, that you don't even need herbs for your elimination or your digestion anymore. So I can take those out. Or maybe you weren't such a good patient and you didn't follow my guidelines. So I still have to keep giving you herbs for your digestion and your elimination. So that's why we have follow-up. So I can adjust the treatment. And this is why we do not sell these products online. They're not available online. They're only available for my patients and clients. And I keep my rates very low because I know my goal is to just help the client to get the right diet, the right herbal products, so we're not making mistakes. And if there is a mistake, then it's my responsibility. Then I'll change the product. Then I'll give a new product without cost. But when the people are picking by themselves, you don't know what they're doing because they don't know what they're doing. And so I just don't do it. I don't do any appointments with anybody. I don't provide any herbs to anybody unless you do an appointment so I can pick them. And then I take responsibility. Then if you take it and you don't get any results, I'm like, oh, let me give you another formula, no cost. Because I made it, I recommended it, you took it as directed, and we didn't get the results, so it's my responsibility. This is a much better system. That's what you're paying me for. All this Googling, all this research, all this looking online. Everybody does this for usually anywhere from 5 to 10 years before they come see me. And, same for diet. People try all different diets all the time. And then I give them the diet, feels great, improves their digestion. But then they think back, well, like 10 years, I tried so many diets. Well, it wasn't necessary. Ayurvedic diets have been around for thousands of years. I mean, once you know you're Vata Pitta or Pitta Vata or Pitta Kapha or Kapha Pitta, or, then we know the diet's going to work best for you. And it's a lot easier to just learn this, is learn it early as you can in life. Get the diet that's suitable for you so you can stop guessing which diet is suitable for you. And of course, same for herbs. It takes decades and decades and decades to learn these herbs. So there's really no way anybody's going to do it in a short period of time. So you really need a very good herbalist to assist you. So that said, I hope that gave you hope. I hope my testimonials inspired you that arthritis, even serious cases of inflammatory joint condition, are 100% treatable. And I have almost probably a 95% success rate. And I'll probably have to blame the other 5% on the client not taking their herbs. So, or sometimes, it throws us off. Sometimes we find out it's an autoimmune condition, so we have to change the treatment. So, sometimes I give the herbs, no results. Then I start looking at blood work, look at the inflammatory markers, and then, maybe determine this is autoimmune cause. So then we have to give completely different herbal treatment. All right. Anyway, I hope that inspired you. I hope that makes you feel that there's big possibilities for improving your joint pain, and you should not have to live with it. It is not part of aging. It doesn't matter if you're 25 with joint pain. Well, if you're 25 with joint pain, you better really get serious. Or if you're 85 with joint pain, that doesn't have to be part of your life. That's false thinking. You don't have to be urinating at night because you're elderly, and you don't have to have joint pain just because you're elderly. You need to understand it. You need to treat it. And once it's treated, you won't have it. Okay. Thank you very much, ladies and gentlemen. I wish you the best of health and happiness. God bless.